As part of efforts to boost vaccine manufacturing capacity in the ECOWAS region, the Director General of the West African Health Organization has challenged member states to step up research efforts that would enable them produce their own molecules for vaccine production. There's more on the following report.
Economic Community of West African States, COVID-19 cases has continued to increase for the past 2 years. The sub-region has recorded 837,442 cases, representing 7.3%, with 11,348 deaths, representing 4.5%, and a case fatality rate of 14% as of May 1st, 2022. Given the vulnerability of the ECOWAS population to the COVID-19 pandemic and other diseases, the Director General of the West African Health Organization, Professor Stanley Okolo, is urging member states to consider producing their own vaccines, as well as building more human resources for the manufacturing of vaccines.
The issue of ensuring that we promote and bring in research to bear, but there are other areas that are key. Power. Electricity. It is very key, and if you look at some of the things that I understand is going on in Ghana, where you have some industrial zones, and in those industrial zones government tries to prioritize electricity supply, and that is very important because you then see that that's one way to. The next thing is capacity, in terms of intellectual capacity, in terms of human resources. We really need to start supporting a lot. I mean, for us in WAHO, we have given nearly 44 across the region postgraduate scholarships in shortage areas, not necessarily specifically for manufacturing, but in shortage areas. And these are some of the things that we also have to be thinking of. And then finally, we have this integrated work with the Department of Industry and private sector, where we are looking at what are the precursors, the active pharmaceutical ingredients that we have in the region. We do have some, but the difficulty for manufacturers is that we don't produce them in commercial quantities. But what I'm challenging us is to think about also the research in order to start producing our own molecules and how we can do this.
Speaking on the intellectual property of manufactured vaccines, this is what he had to say.
If you remember, take your mind back to what happened with HIV. When anti-HIV drugs were produced, they were extremely expensive. Okay, but then the United States government came in and other global partners and said, no, we've got to make this the intellectual property in terms of the patency. We've got to release this so that generics are produced, so that those generics are then cheaper to save lives in particularly third world countries that HIV was ravaging at the time. So why can't we apply the same thing? I mean, this is a global pandemic that's affected everybody, and this is an opportunity to have. So we have to think about that. But if you think about it for Africa, we're talking about asking people to give us things, isn't it? That is still the same thing with what we therefore need to start thinking of. Why? We've got the brains. Why can't we then focus, invest in it, and ensure that we give them the mandate and the political will to go ahead and discover some of our own? Cuba can do it. Other people can do it. Believe you me, we can do it. The things that we need is to, first of all, say that there must be an unrelenting laser focus on it. That's number one. Number two, to say, look, we are not going to care which country it is, but let it be an African or West African component, and we can do that.
The outbreak of the COVID-19 pandemic has shown gaps in the health system of the ECOWAS region, thus the need to discuss issues pertaining ECOWAS potential vaccine manufacturers and stakeholders. Mausi Numan's report for JoyNews.